Welcome back to Sage Connections. Today we're exploring a therapy that's creating a lot of buzz in the integrative health world, ozone therapy. From boosting energy and immunity to supporting healing and recovery, it's a treatment people are curious about but may not fully understand. Today I'm joined by Mallory Capp, RN and founder of Michigan Immune Defense, to help us unpack what it is, how it works, and who it can benefit. Enjoy. There's a lot of buzz around ozone therapy. So
Yes, there
let's
is.
just start with the basics. What is it?
It's a great question. It's a little bit of there's a little bit of things to touch on. So there's kind of route of administration, but let's truly start with what ozone gas is. So ozone was actually discovered a long time ago. It is a gas. It is what happens when oxygen, so an oxygen molecule, two molecules of oxygen, gets exposed to electricity. All right, so the first time they ever found it, there was a lightning storm. Lightning hit oxygen and it changes the oxygen molecule. It breaks them apart and then they reform into some reform into oxygen and others reform into O3 molecules. So three molecules of oxygen, which is ozone gas. So
Does this
it
have anything to do with what we were told in the 90s where the ozone is breaking? There's holes in the ozone. Is there any connection to that?
different,
Totally
different,
different.
different. Yep. So that's
Okay.
the ozone layer of
Yes.
the Earth sky, right? This is an actual gas.
Got it.
But it
Okay.
is important to know that it is an actual gas. It isn't like a vitamin or mineral. It's a gas. It really is a gas. So and when we make it and use it in a therapy form, we take medical grade oxygen, okay, and we put that through an ozone generator, which is literally just a box that exposes the medical grade oxygen to electricity, and then out comes ozone gas. So it's the gas is what we use in the treatment. It has a ton of different properties, which we'll get into later. But basically, medically, it's been used in a couple different routes, and the main way that we use it is intravenously. So, and the reason being is it is the most systemic method of getting ozone because you're getting it right into the vein. It goes to every single piece of your body. So there are other routes of administration, but the most systemic and far-reaching way is through intravenously, which is the way we're giving it. So we
Very.
can deep dive all of the different routes and therapies and all those things, but that's the basis of it.
That's what you guys do specifically.
That's specifically what we do.
Okay. So then let's start with, so what are the main conditions that you treat with ozone? What are some wellness goals for ozone therapy? Who does it help?
Great. Um, that is a great question. It truly, I know this seems cliche, but ozone truly can help everybody. Um, as long as they, are not contraindicated to it, as long as we do a health review and make sure that they are eligible for it.
What's a
But
contraindication?
a contraindication would be mostly like if you are allergic to heparin, because we do have to use heparin in it. If you
Which is
have
what for people that don't know?
a blood thinner.
A blood thinner. Yeah. Okay.
Yep. So it's a blood thinner. So an allergy to heparin would be a contraindication. You can't while you're pregnant get ozone therapy. And then if you have just like a really extensive cardiac history, then we usually need approval from your cardiologist. So there's some things. And then if like you have a blood clotting disorder too, that would be the other thing.
Mallory, is it
So
any blood thinner? So like even if someone's taking a baby aspirin preventatively, does that count as well? Or is it heparin specifically?
no, you can actually even be on heparin and still get ozone. It just depends on the reason why,
Hmm.
what dose, how often you're getting it. The specific contraindication is if you're actually allergic to
I
the heparin, right? But if you're on a blood thinner and you're stable and you have a stable reason for being on it, then we can still proceed with caution, but we can still get you ozone therapy.
okay.
So, but to answer your question, I categorize the target audience for ozone into three different categories of people. So we have the prevention crowd, all right, which is the broad crowd for people who are looking for ozone for longevity, right? For biohacking, the anti-aging. These are the buzzwords that you hear associated with it. And those are, but in essence, what they're trying to achieve is prevention. Okay. So they're looking for lack of chronic aging symptoms, lack of chronic disease as we get older, making sure that our cells stay healthier into our later years, which makes you have anti-aging effects, longevity, prevention, biohacking. So ozone is huge for that population. Okay. Because it truly works to reduce oxidative stress in the body. And oxidative stress, a more common term is toxin buildup that we get from a lifetime of exposure to poor diet, stress, sleep, deprivation, you know, pollution, anything that can cause a buildup of toxins in our body. That is the essence of having symptoms of, old age or having symptoms of chronic disease. So if we can reverse those, then we're going to prevent chronic disease, signs and symptoms of aging. So the
So
one
it's
population,
so
go ahead.
it's a essentially a powerful antioxidant. Is that
It's actually oxidative,
it's
which is
ox? Okay.
which is a great observation on your part, Luba. Um, so we are actually training the body. We're creating a small dose of oxidative stress with ozone.
Mm.
And so what we're doing is by creating this small dose of oxidative stress, which is partially the same thing that is causing damage in our body, but we're doing it at such a controlled level that it actually triggers the body to basically wake up. Okay. So we have, this state of inactivity from overload of oxidative stress from toxins. The body almost forgets what to do with it, forgets how to produce its own antioxidants, forgets how to, fight back off of inflammation. So what ozone does is it comes in and creates again a tiny little controlled oxidative stress, triggers the body to wake up, triggers the body to again start producing antioxidants on its own. So it teaches the body to heal
I
itself
see.
again.
Okay.
Which
Very
is
cool.
what's so powerful about the therapy is we're not just supplementing things to the body constantly and being the source of antioxidants for the body. We're just teaching the body how to do it itself,
Perfect.
which
Okay,
is
so
super
category
fun.
two.
Category two, are performance seeking people. So people who are really trying to elevate their life and whatever athletic performance is a huge one. Okay. So because of the increased utilization of oxygen um, with ozone. So that doesn't mean just we're hyperoxygenating the body, but we're also teaching the body again to use oxygen better, to use it more efficiently. And it works through the Krebs cycle and all of those good things that we learned in eighth grade biology to create more energy. Okay. And to allow the muscles to work more efficiently. So they've actually done studies to prove that athletes, especially runners, can improve their running time by 20%, which
Wow.
is huge. I mean,
Yeah.
20% is a massive increase. So it's going to really help with athletic performance, but then also just like, that high performing individual who wants to be at the top of their game, right? Wants to have the energy, the mental clarity to be at the top of their game. So that's category two. And then category three is are people who are actually already suffering from some sort of chronic disease.
Mhm.
Okay. So these are the people who have reached that level of oxidative stress in their body where the body gets tipped over the edge. Okay. So they're having this chronic inflammation inside their body that their body can no longer maintain on its own. And along with that comes chronic fatigue, chronic brain fog, all of these symptoms. Those are the people who oxygen or who ozone therapy is super powerful therapeutically for, because it actually teaches the body how to deal with and regulate oxidative stress.
So we're
So
talking like chronic pain patients.
we have chronic pain patients. I've actually had really great results with joint pain.
Hmm.
Has been a really big thing. Uh, but more, I would say chronic pain, but I would also say chronic. autoimmune conditions. So we have, or chronic long haul type conditions, kind of the hard diseases to treat that don't really fit in a good bucket, are hard to treat conventionally. Even alternative doctors have a hard time treating. People who've had, long-term mono, long-term Lyme disease, long-term COVID now that we've are in the post-COVID era, those people aren't finding relief from a lot of different modalities, but ozone is very powerful for them.
Very cool. So if we're taking category 2 and 3,
Mhm.
how many sessions would it take to see benefit? So let's start with the athletes.
Okay.
Someone, yeah.
That's a great question. Um, so every ozone therapy needs to start with a loading dose. Okay, so it's a great question. It's very highly researched. Ozone therapy is. I mean, there's over 2,500 research studies to back all of the good reasons and how to do it and all of those things. So it's proven that it needs a loading dose, and that means weekly infusions. Minimum of four. For an athlete, I would say 4 to 8 sessions would probably be where they need to be. And that would be timing well before a big event, right? So, like the free press marathon that's coming up soon. Those 4 to 8 weekly sessions would be best served for those athletes trying to get a better time on the free press marathon starting now, right?
Mhm. When
And
is
actually
the,
even starting a little before.
so are we 8 weeks? I don't know when it is. We're eight
I
weeks
think
out?
we're closer to like 6 to 7 weeks out.
Okay.
So this would be a good time for it, but anywhere from 4 to 8 weeks out is the best time to start for athletes, and I would say that would be a good pre-event type of loading dose for them. Now, for the chronic disease people, they're going to look more into 10 to 14 sessions, weekly sessions. And that's because we start at a low dose for these patients because they're so sensitive and we have to be careful not to put them into a higher detox. So we start at a low dose and we gradually increase as to their tolerance. So it takes a little bit longer to get up to the higher doses and to get their body to heal itself because they've been suffering through chronic inflammation and oxidative stress for so long.
Right. And that makes sense because when you're treating any kind of chronic condition, it's not a quick fix usually because the body has already adapted to, like you said, those inflammatory responses, neurologically even. It's adapted to feeling the pain signal. And so from yeah, all standpoints, whether it's ozone and IV therapy or physical therapy, definitely chronic disease takes time to rewire the system into a healthier state.
Absolutely. You nailed it, and that's I think pretty self-explanatory and most clients who come in kind of understand that. They're going to be a little bit take a little bit longer and it's also for their comfort because when you are getting the ozone therapy, there is a detox that occurs, right? So we're pulling out the toxins. And so if you go too fast or go at too high of a dose, especially for chronic patients, they can have days of detox symptoms. So headache, fatigue, almost feeling like they have the flu. So we want to really try to avoid those periods for them while building their body up and building the ozone up in their body. So it's all, done in a very set protocol for a good reason.
And what about for the preventative category? So we're going into a change of season, right?
Okay.
So we're having temperature changes, we're having pollen and seasonal allergies come into full bloom. So
Thanks again.
does ozone help with that the transitional parts of our seasons as well?
That's a great question. Absolutely. And that would be, for people who are typically already healthy and looking for prevention, their loading dose would probably be closest to four doses. But it does because, allergies are an inflammatory reaction, right? It's a histamine reaction. So they are going to benefit from ozone because we're going to help the body again, wake up to um, that histamine reaction that comes in right from the allergen. And then it's going to help turn on the mechanisms that the body needs to do to heal itself instead of relying on antihistamines and all sorts of fun allergy meds that we have. So, I mean, those might still be necessary, but it's going to help especially too because the other favorite thing of mine that ozone does is modulate the immune system. So whether you have a hyperactive immune system, like people who have allergies or autoimmune conditions, their immune system is, working way too hard and at times attacking itself, right? Attacking the own body. So it'll actually regulate the immune system back down. And then for people who are in, immune states that are decreased, like people who have been, treated for cancer and people who have chronic diseases who are just constantly fighting off infection, their immune system's too low, so ozone intuitively will help raise it. It's a pretty impressive therapy.
Yeah.
How, but it's really not the therapy, it's the body, right? The thing that and I have to even remind myself sometimes is the body knows how to heal itself. The body knows what to do as long as it's given the right methods, and the right nutrients and the right ingredients. So if the body is given what it needs, it will heal itself. It just sometimes takes a little bit of rewiring to do so.
Yeah. So it sounds like you're just creating a pathway for the body to heal itself.
Mhm.
Very
We're
good.
creating that trigger.
And so you also do all kinds of IV therapy.
Mhm.
Um, Mallory's actually a returning guest. So we've talked a little bit about how IV therapy can help during pregnancy, and you can check that out on my Instagram, that conversation. But do you use ozone therapy in conjunction with IV therapy, or is it just one at a time?
That's a great question. So during the actual session, we separate. Um, so what we do that's slightly different at Michigan Immune Defense with our ozone therapy is we do provide extra hydration at the end of the ozone treatment, and we do provide a low dose of B vitamins to give a slight antioxidant. Okay. We don't want to give strong antioxidants on the same day as an ozone therapy because remember, ozone is oxidative. So if we give a ton of antioxidants right after we give ozone, we're just going to counteract the therapy. So giving a full-on IV infusion, vitamin infusion that we give in other sessions would actually completely counteract ozone. So what we do instead is we give extra hydration and a tiny bit of B vitamins to just help the detox process not overload the system. Okay, so just to kind of help balance people out, make sure that they tolerate the dose and they're good. But all of the other infusions that we offer have much higher doses of vitamins and high antioxidant properties. And those are extremely beneficial still to the individual, but just not on the same day as an ozone therapy. So once people get through the ozone loading dose, which we usually just do ozone during that time, then we hope to get them to, more of a routine maintenance schedule to optimize their body, keep them healthy, and keep them performing at the health that they want to be at. Then my recommendation honestly would just be to go forward with monthly infusions and rotate between ozone and IV therapy, like vitamin therapy. So that I think that's kind of the sweet spot to take it to continue to get ozone regularly, maybe every other month, because let's be honest, our body's constantly being exposed to toxins, constantly needing a detox. So if we get that ozone therapy every once in a while, and then intermittently also get the vitamin or nutrient infusions, then we're optimizing our body that way as well. So that's kind of, we have a program with Michigan Immune Defense, which is designed specifically to get people set up that way.
Fantastic. Are there any misconceptions that people come to you with for ozone therapy? Are there any like things that people believe about it that maybe aren't true? Or like, I guess, what are the common questions people have?
Well, most people just don't know what it is.
That's true.
That's the biggest thing. So it's a lot of education. Some people have heard of ozone because of the different routes that it's able to be administered as well, because you can get, you know, interarticular, you can get joint injections with ozone, you can do a bunch of different modalities for it. And I think the other biggest problem is that it's not widely accepted as a traditional therapy in the United States. So there is that angst that some people have because it's not technically FDA approved. But as we know, a lot of therapies that are actually preventative and provide answers and provide, long-term benefit to people, unfortunately, are not always FDA approved. But I can attest to the fact that it is widespread in Europe. It is actually part of the national healthcare system in Cuba. So people are very, it's savvy in other countries that, are just kind of a little bit more on top of some of the more preventative side of healthcare, is what I would say. So we just have to kind of battle a little bit of the lack of education. It's not a new therapy. Most people think that because we're hearing about it now, that it's just something that started recently. It's been medically used since the 50s, you know.
Wow.
I mean, it's actually been medically used even before that, intravenously since the 50s. But it was first used medically in World War I for gangrene tissue and healing in the battlefields. So it's been around for a long time. And so there's mostly the misconceptions about this new kind of new age therapy, but it's actually been used for a long time, widely tested, great safety research on it. So it's a lot of education, which I love doing. So I'm happy to
Yeah.
do that.
No, that's fascinating. I can't say that I know or knew a lot of this stuff either myself. So it's very interesting to discover it. And there's so many different cases that I'm thinking about, different people that I think would benefit from this. Do you have any favorite stories about the effects of ozone therapy? Do you have any patient case studies
Oh yeah.
that you love?
Absolutely, absolutely. One of my favorite clients in case studies is a client of mine who's had is one of those chronic condition clients, right? Who's had a lot of issues over her life with brain fog, especially, and energy, chronic fatigue, and just everything is sensitive in her body, right? She's very sensitive to anything. I've actually given her an IV vitamin infusion and it knocked her down for 2 weeks because she had such a just internal reaction to it, so it really just you have to go super slow with her, low doses on everything, and something as simple as a vitamin infusion, even was too much for her. So when ozone therapy came up for her as her therapy, I was super excited about it because I knew that it would be great for her. But I also knew I had to start very slow, very low dose, and it would take time. It would take close to 10 to 14 sessions to start making her feel better. So we proceeded, and after the first session, she said that her husband noticed a complete change in her brain fog, like the same day.
Wow.
She noticed a change in her brain fog, her energy levels, and she also sees an acupuncturist who could tell immediately that the changes in the flow of her body. Acupuncturists always look at your tongue, and she said that her tongue has never looked more clear after just 1 to 2 sessions. And she is a huge proponent and fan of it, and she has been continuously getting ozone ever since and feeling better every time. So she's one of the ones who I was most nervous about to start ozone with, and she did the best so far. So
Yeah.
it's wonderful when you follow the right protocols and go at the right dose and start slow, and uh and that's just really exciting. And then the improvement in joint pain for people has been a kind of a pleasant surprise for me, and the energy levels. It's been wonderful, but I would say that's my favorite case study.
Fantastic. And then we did an episode on perimenopause. I know that during pregnancy, it's contraindicated to do ozone therapy, but have you seen or read anything about how ozone therapy could support perimenopause or menopause? I know there's a lot of changes going on in the body. Have you heard anything about that?
Yeah, for specific like research on that, I'd have to do a little bit of a digger dive or a deeper dive. But what I can say is that for people who are, having symptoms of perimenopause that include, trouble sleeping or decreased energy, ozone's going to be a big help with those things because those are two huge symptom uh, what I'm trying to say, or those are the things that really symptomatically they help with. So energy is notice a huge change in that. They notice a huge change in their sleep pattern. So yeah, so I'll have to do a little deeper dive on the perimenopause specifically, but I definitely can say that certain symptoms that clients are having associated with the perimenopause, it's absolutely going to be helpful.
Yeah, because if you take care of the sleep, then in turn that helps with mood and
Right.
and brain fog and all sorts of things. So
Right. Yep, absolutely.
wonderful. So thank you so much. Do you have any last words? Anything else you'd like to add to tell our audience about ozone?
Um, just not to be afraid of giving it a try. It's very safe. They even have compared it to being safer than taking an aspirin, which is pretty exciting to me because it is a process that we do, and I like to explain this to people before they ever come in. We do take out the client's blood in a very sterile controlled environment where we keep everything in a closed system. And then we ozonate the blood with the ozone gas, and then we give the blood back. So it is a session where you're sitting there and, blood is going to come out into a bag. It's going to be ozonated and then it's going to be given back. So I like to just prepare people for that. But everybody who actually comes and gets it done or sees a session done is like, oh, okay, that's it. It's really simple, really easy. You don't even have to see the blood if you don't want to. We can keep it behind you. You won't even notice it, but just not to be afraid. It's a very powerful therapy that's been around for a very long time, and it's helping people. That's what we're all about.
Fantastic. Thank you. Thank you for everything you do. Thank you for having this conversation. I think it's going to help a lot of people. If nothing else, then it should drive people to research this and see if it's right for them. So I really appreciate it.
Absolutely, and thank you for, hosting these podcasts because we're spreading knowledge to everybody who need it. So you've been
Absolutely.
wonderful. Thank you.
Thank you. Bye-bye. Thank you so much to Mallory Capp for sharing her expertise on ozone therapy. And thank you to all of you for tuning in to Sage Connections. If you'd like to learn more or connect with Mallory, check out the links in our show notes. Don't forget to subscribe so you don't miss future episodes where we continue exploring ways to take charge of your health. Until next time, take care of your health and your wellness.